Hi, I'm Marianne Bohr with HIMS, and I'm here with Jim Tyrell, Vice President of Global Product Strategy at Transaction Network Services Communications Market. Hi, Jim. Thanks for joining us today.
Great to be here, Marianne. Thanks for having me.
So, Jim, why is voice calling such an important communication channel for healthcare organizations?
Yeah, great question. Hospitals and healthcare systems regularly call patients to schedule appointments, discuss prescriptions, and advise them on how to enroll in health plans, coverage, and billing. There's some information, though, that you can only convey effectively in a voice call, such as the benefits of choosing a particular healthcare provider or a plan. This can ensure that the patient understands what's being said and questions can be answered in real time, something that's impossible to do via a voicemail or other communication channels. When healthcare organizations are trying to communicate more complicated or urgent information, unanswered calls can result in care delays and may even negatively impact patient outcomes. For example, reaching a spouse to get consent for critical care would require an interactive phone call.
Absolutely. So, can you tell us how has patients' trust in voice calling eroded? And can you maybe share some data with us about that?
Yeah, 100%. So, in our latest executive brief with HIMSS, we explained how it can be challenging for many healthcare organizations, such as hospitals, pharmacies, doctors' offices, and insurance groups, to deliver critical updates to patients via the voice channel. Unfortunately, trust in voice calling has eroded due to the onslaught of unwanted and scam robocalls. This has become a catalyst for lower answer rates. TNS data shows 66 billion unwanted calls were made in the last 12 months. On a monthly basis, this is between 4 billion and 7 billion. That's completely staggering. Not surprisingly, our survey data shows that 68% of Americans never answer a phone call from unknown numbers. Again, due to the large number that we've seen from unwanted calls. Yet 60% prefer to engage with a phone call rather than any other method with their healthcare provider.
Right. So, can you tell us what is call number spoofing and how can this type of fraud impact healthcare organizations?
Yeah, sure. So spoofing is when a bad actor uses a legitimate organization's phone number to convince victims that they're talking to a known and trusted source. This type of fraud can be used to access confidential patient and financial information. And unfortunately, healthcare organizations are often unaware that they've been spoofed until it's too late, potentially leading to a loss of reputation from their brand and erosion of patient trust. We have survey data that shows 69% of respondents are concerned about robocall scams that claim to be from an insurance provider, and 62% said that they've received at least one health insurance robocall scam during open enrollment in 2023. With open enrollment for 2024 about ready to start in 2 weeks, we know that the bad actors are going to rotate to these types of scams again, and consumers will be unwilling to engage due to these concerns about spoofing that they're not talking to a legitimate organization.
Those are interesting statistics, Jim. So, what kind of solutions are available that can help healthcare providers protect their brand and their patients' data?
Sure. So deploying enterprise authentication and spoof protection from TNS can help healthcare providers prevent against attacks by ensuring that only verified, branded calls are delivered to the consumer. Spoof protection can further safeguard healthcare organizations and customers by immediately blocking any unverified calls from using healthcare provider telephone numbers. That's because each registered call is monitored to reduce vulnerability to sophisticated voice fraud attempts.
I see. So, can you tell us how branded calling and voice call authentication technologies can make it easier for organizations to reach current and prospective patients, including some of the other benefits?
Yeah, sure. So branded calling can encourage patients to answer the phone and engage in more meaningful conversations. 84% of surveyed US adults say they would answer a call from their healthcare provider, whether it be a doctor, pharmacist, or another organization, if their brand, logo, and name were displayed on the incoming call screen. As a proof point, one nationwide healthcare provider that deployed branded calling saw its answer rates increase by 41% with enterprise branded calling from TNS. The healthcare provider is using voice calls and branded calling to better understand patient care needs to mitigate the risk of unnecessary hospital admissions. In addition, what we found is that reducing the frustration caused by repeated unanswered call attempts can improve your employee satisfaction within the contact center agent community.
That's certainly a big increase. So, Jim, what should healthcare leaders consider when they're selecting technology solutions for outbound calling operations?
Yeah, that's a great question. I see four main considerations. First is scalability. How many telephone numbers can the solution support? Second is ease of use. Are there APIs that make onboarding and reporting easier? Third, access to real time information. Can organizations access up to date reporting of compromised telephone numbers? This can then lead to the contact center agents asking additional questions and alert them in real time about real time scams that are happening. And then lastly, security. How many subscribers are there and how many can you cover? And how does that affect your security posture?
Well, Jim, thank you so much for joining us today and for sharing your insights with us.
Thanks again for having me. And hopefully this was great for your constituents.
And for our audience, if you'd like to know more about how to restore your patients' trust in voice calls, please download the TNS Executive Brief at www.tnsi.com/HIMSS. Have a fantastic rest of your day.